Assalamu alaikum viewer. Today videos is very important regarding the gender sign. In this video we'll tell you different signs that can predict the male or female gender. It's very important to watch the whole video so that you can find different ways to assess the gender of the baby in a pregnant lady, and it's very informative. Please watch the video till end and like the video and subscribe the channel. Coming to the live case, this is the ultrasound of a lady that is 25-year-old, and this is her second baby. First of all, we'll see the hypothalamic plane to calculate the BPD, HC and scar thickness. The BPD and HC correspond to 32 to 33 weeks of pregnancy, and the scar thickness is about 1.8 millimeter, that is quite thin. The thin scar may result in early labor pains before the 37 or 38 weeks of pregnancy. So this is the scar thickness and BPD. Viewer, please watch the video till the end. So fetal heart rate can predict the gender of the baby. If this rate is less than 140, most of the time the gender is male. And if it is more than 140, it could be sign of a female, because it is due to the male pattern hormone that are present within the fetus. So after calculating the BPD and HC, we will like to see the cord around the neck and cervical length. Cervical length is about 3.3 centimeter, and it varies from 3 to 4 centimeter. If less than 2.5 centimeter, that may result in abortion or premature labor pains. There is no cord around the neck on power Doppler study of this fetus. Cord is likely to be seen between the head and the shoulder region. So there is no cord around the neck. Coming to the fetal cardiac activity, you can see the fetal cardiac activity that is present, and we would like to calculate the fetal heart rate with the help of wave pattern. And you can see the fetal heart rate is less than 136 per minute. And in coming video or coming frames of video, we would like to show you the gender of this baby. Facial appearance and tummy shape can predict the gender as well. In case of male baby, there may be bulky or facial swelling within that female, and skin may be thick as well because of the effect of the androgen. And in case of male, the tummy may be flattened, while in female it is more towards upside. So again, coming to the case, you can see the abdominal circumference of the baby at the level of the gastric bubble. We will calculate different parameters to find out the fetal age, weight in this live case as well. The spine of this fetus appears to be normal as well. There is no gap. Railroad phenomena is okay. Now you can see the femur, and would like to calculate the femur length. So there are some confirmatory tests as well, and still there are some other signs for confirmation of the gender. The other signs that are present are color of urine or the pH of the urine, and the behavior of a female carrying the fetus. So this is the femur length. After calculating it, we would like to see the fetal weight that appears to be 2200 gram, and fetus is at 33 weeks of pregnancy. Most of the confirmatory tests that comes to find out or to see the gender of the baby is the ultrasound. Good quality ultrasound at 20 weeks of pregnancy can predict the gender very clearly. Either it is male or female. In case of male, there is scrotal sac and the penis, while in case of female, there is 3 lines or burger sign. So you can see the gender very clearly. It is male. You can see the scrotal sac, penis. See, the heart rate was less than 140, and most of the time I have observed in case of male gender the heart rate is less than 140. The placenta is fundoposterior. Urine pH can calculate or help out to find the gender of the baby. If it is acidic, it is female, and if it is alkaline, it is male. We have to do the litmus test for this. If we put the litmus paper within the urine, if the color become red, then it shows the acidic pH, and that can be the indication of a female baby within the uterus. So these are the fetal parameters that you can see. Liquor is okay. It appears to be normal. So again, we also see the gender and the SD card ratio of the umbilical vessels. In the early weeks of pregnancy, the SD card ratio is more, while towards the end it decreases. The SD card ratio usually shows the resistance of blood flow within the umbilical vessels, and it can predict the growth of the baby, either IUGR or normal size baby. See the gender again. It's very clear in the good quality ultrasound. There are some other signs of the gender determination, like morning sickness, that is increased vomiting within females in early morning. There is more weight gain due to the increased effect of the estrogen in case of female baby. There is more appetite towards sweet things and the salty thing when there is female baby. In case of male baby, due to fact of the testosterone, the muscle mass is more and the fat is less, so the baby weight is not much more. So again, coming to the live case, there is the hypothalamic view, and you can see the lateral ventricle, and the diameter of the lateral ventricle is within the normal limit, that is about 9 millimeter. If it is above 11 millimeter, it is significant. There are some other signs like hair pattern. In case of female baby, there are thin hairs on the face or body of the female. In case of male baby, the hair's growth is dense and thick, and in case of male baby, the female has got more acne on the face due to the effect of the androgens or testosterones. But in case of female, the skin is fair. Thanks for watching this video. Viewers, please like the video, share the video, and please subscribe our channel.